we can vaccinate our community. We believe in really a couple of short days to have everybody in the whole community vaccinated quickly, efficiently, cheaply, and done. So last week we had discussions with our local family health team, Dr. Newberry and Dr. Rancha, as well as the NOSH team, talking about the potential impact of having at Wilson Memorial General Hospital with the high number of cases within the hospital at that time. Thursday of last week, there was 9 in the hospital, 8 in the community, so 17 cases active with 2 deaths. So it was quite concerning, and more concerning than anything was the fact that our hospital now had lost 4 nurses due to COVID-19, so there was a shortage of our nursing staff within a hospital. Small rural hospital is very important to have that support staff. Without that, hospitals don't function well. So they had a hard time backfilling those positions, so that became a real concern, not only for the patients and the staff within the hospital, but of course also all other residents in our community. So then they asked together to the municipality to support a resolution, a letter, more or less from them to create a resolution to have sent off to the medical officer of health for the Thunder Bay District, Dr. DeMills, as well as our local MPP, Mr. Gravel, as well as our Minister of Health, Minister Haiju, the provincial minister, Minister Elliott, as well as the Premier Ford. So we called a special meeting for our council on Monday to pass a specific and special resolution, and that was the only thing that was on the agenda, was to have that resolution identify the impact it was having in our community, the potential it could have for future impact at the Wilson Memorial General Hospital, and of course, the future potential of more deaths. Well, we had 1 more death over the weekend, and the numbers have subsided a bit since the Thursday discussion. The letter went out this morning because of the Easter holiday weekend. So we'll continue to monitor that situation, but we still believe it's very important to vaccinate small and rural communities, similar to what has happened in BC, where they're doing this as communities of specific interest or a huge outbreak and potential impacts on local hospitals.
Well, in the far north as well of Ontario, we're very similarly isolated in our communities. I'm shocked, frankly, that wasn't part of the plan from the get-go to get our communities vaccinated as well, because they are such tight-knit, small communities. I think you've also been frustrated, right, about marathons having to kind of just follow whatever's going on in the city of Thunder Bay because we're the district, and the medical officer of health not being willing to kind of look at our small towns as what they are, like being separate from this big city, and not only separate in regards of population, but separate in regards of services as well. Like, we are at such a disadvantage when it comes to these sorts of situations, right?
Absolutely. I mean, I've had some discussions over the last several months, actually going back to last fall, with Dr. DeMille about the impact it was having on the city, and of course the second wave, and now we're into the third wave, and the distance we are. And I just specifically identified that through a discussion and a resolution back in the end of February, early March of this year, to identify a marathon. And I can't speak for my fellow neighboring communities, but I mentioned them, but that was up to them individually to address that. But being 300 kilometers away from the center of the outbreak, which was in the city of Thunder Bay, we felt that we didn't need to go into the gray zone, but also willing to identify that if there was an outbreak in our community, we would automatically go into gray zone and shut down our recreation facilities, as well as our, personal hygiene, businesses, which, aesthetics and barbershops and hairdressing studios. Of course, we would do all the right things. So we didn't get any support because there was no mechanism, Dr. DeMills felt, within the health mandate to separate communities within a district, a health district. So we live with that, and then of course we've seen a huge outbreak in our community. So I understand all the politics and the mechanisms within it, just a little frustrating. This case is exactly what you just said earlier about the far north and northern communities and First Nation communities being vaccinated because there's a high volume of co-living, one thing, and of course remoteness, and not always the availability of healthcare facilities. So similar to what we were talking about, Wilson Memorial being locked down to the community, it has a huge impact not only to Marathon but our First Nations neighbors. So that was one of the arguments, and just the fact that we're rural, remote communities. We really are. We have a Trans-Canada Highway, but we know, and you live in Manitowoc and I live in Marathon, and we're okay with that. but we are remote. We're a rural, remote part of the country. So when we talk about Southern Ontario communities or communities specifically around Thunder Bay, for example, the 6 communities that are bordering the city, they're not remote. They all utilize the city for all their services. And I don't. None of those communities have a hospital. A lot of those communities don't have recs like arenas or pools because they utilize the city. So I don't consider them remote. I consider all of us on the North Shore and up the Highway 11 corridor remote. So
I think that's part of the problem with the language from the province in the first place. Last week, it was in regards to something different. We were speaking with the MPP that's the critic for children and youth, talking about like rural and northern. And I was trying to explain to this MPP, we're rural northern. We're not one or the other. We're not some farm 30 minutes from Toronto. Like we're like it's. I don't think there's a concept of like what our communities look like and how isolated they are at the end of each of our highways off the Trans-Canada, right? Like,
you're absolutely right, and I wish I could bring that message. And I know that the governing government today understands that, but a lot of those members, those MPPs, sit in the GTA area. Really, mostly that's the biggest group of them representing Ontario. And when you're absolutely right, when you talk rural Ontario, we are definitely rural Ontario, and we're northern rural. And you're absolutely right. When you're 35 or 30 minutes outside of the city of Toronto in a farming area or outside of Ottawa,
or even Thunder Bay, yeah,
or Thunder Bay, you're not rural. You're close to the urban centers of our province. So we made the argument. I hope there's some traction. I had a great meeting with Minister Hajdu this afternoon to discuss that resolution because it was sent to her as well. And she's going to have discussions with her counterpart on the provincial level, Minister Elliott, and also with Dr. DeMille. And if there's some opportunity to get an additional 2,200 vaccines for Marathon this week or early next week, and then the next hot spot, it's like I believe right now maybe Terrace Bay has got a higher number of cases. I know Manitowoc has got a couple of cases, but not a high number. It's not a priority. So let's look at those. Greenstone is getting there. So let's look at those communities and vaccinate them en masse, and then. We're good in the eastern part of the Thunder Bay district, and you can focus on the city and the surrounding communities around the city.
And I think for the province too, there's an opportunity to talk about like spending funds wisely and doing like stretching our dollars as far as they can go, because you were speaking during your special meeting this morning about like having to travel to Thunder Bay every week for these small quantities of doses. Marathon has an airport, but also like even if it was one drive would still be better than every week. Like there's lacking logic in that. The idea that like it doesn't make any sense from any perspective, whether it's financial or lives, right? Like,
well, absolutely. Karina, we when I spoke to Minister Hajdu, I talked. She's on the federal level. They don't deal with health. They pass the dollars onto the province, and the provinces deal with health, and then they go to the local health units. But I said, in most cases, in rural Ontario or rural Canada, for that matter, municipalities, with the services they have within the municipalities, can really do a lot more on the ground than a government can, whether it's provincial or federally, because we have committed people that are neighbors, friends of each other, that are willing to step up, and we can vaccinate our community. We believe in really a couple of short days to have everybody in the whole community vaccinated quickly, efficiently, cheaply, and done. So you're right. When you call all these clinics, and I got to go to the pharmacy, got to go to this little drop-in clinic, get 30 people, 50 people vaccinated. Run to the manors, to our long-term care homes, our old age facilities, our hospitals.
Well, and our pharmacies are not on the list of pharmacies getting vaccines, of course, right?
Exactly. We're not a part of the equipped scenario that the province is rolling out. So yeah, there's a lot of things that we could do a lot better, and it's not a criticism for any government. Besides the government and logistics, we can do it locally. Send us the vaccines. Our family health team with the NOSH people from the Wilson Memorial McCausland can vaccinate the community en masse as long as everybody's willing to come and get it done very quickly. So that's what I'm hoping for. And I mean, I know there's critics out there, believe you me, that are going to criticize and say, why would Marathon get it before Thunder Bay? It's not about us and them. Let's focus on really the high priority area. Right now it's Marathon, we believe. Then go to the next high priority area, but you're still going to do Thunder Bay in the process. You're not stopping vaccinating people in Thunder Bay or surrounding area of Thunder Bay. But let's send off the 2,200 to Marathon. Let's send another 1,500 off to Terrace Schreiber or Manitowoc the following week, or whatever community you think that's the next priority, and do that. That's all. And I hope people can understand that. This is not about marathon. This is about marathon priority and all of us together getting vaccinated. None of us in our generation have lived through this pandemic scenario this bad. So it's a lot of learning from all of us. And there's no criticism to be passed around. It's just, let's all work together. That's what I always felt like. And you're right. I'm speaking on behalf of my council and my community. And as the mayor of the community, I want to make sure that all of those messages get to the appropriate people, and so that we can share and help each other. And let's help the next neighboring community and all the way through the district as we go forward.